Do you struggle with knee pain that stops you from enjoying life? Perhaps that dull ache when you're going for a walk with your dog, a sharp jolt when you're walking upstairs, or perhaps just stiffness after sitting for too long.
If you've been diagnosed with knee osteoarthritis, you've probably asked yourself,
Is it just going to get worse? Am I doomed to a lifetime of pain?
can I still exercise or will I cause more damage?
And will I inevitably need surgery?
You are not alone with these worries, and the good news is you do not have to just live with it. In this video, we're going to give you clear answers and actionable steps that you need to live with less pain, build a stronger knee, and get back to doing all the activities you love, even if you're over 55 and you've been struggling for years.
Hey, it's Jack and Brody from Be Mobile Physiotherapy, your go-to experts for strength and fitness for adults 55 plus.
In this video, we are cutting through the confusion and giving you a clear roadmap to better knee health. We're going to help you understand what knee arthritis actually means,
Unpack what your knee x-ray or MRI scans really mean for you,
reveal what treatments truly work and which are a waste of your time and money,
and demonstrate 5 game-changing physio exercises you can start today, right at home with no fancy equipment.
and briefly discuss knee replacements so you know what you need to consider.
Okay, let's dive in. So what exactly is knee osteoarthritis, commonly referred to as arthritis or in short, knee OA? It's a term that can sound scary, but let's actually break it down. Firstly, it's one of the most common joint conditions affecting 1 in 5 adults over 50. But what's actually happening in your knee? Knee arthritis is a complex condition involving the whole joint. It may involve cartilage and meniscal changes, bone thickening, muscle weakness, especially in the quadriceps, connective tissue changes, and inflammation. Now, these are the changes that are happening at the knee joint itself. But how do you actually know that you have knee arthritis? What will you actually feel?
Well, you might notice knee pain, especially with stairs, squats, or long walks. You might have morning stiffness. You might have reduced range of motion in the knee, swelling and potential warmth or heat at the knee joint, grinding, grating, or cracking noises, and a sense that your knee feels unstable. If these symptoms sound familiar, keep watching because you're not alone and we've got powerful, evidence-based ways to help you turn the corner. But first, let's talk about what your scans might mean. Perhaps your doctor sent you for an X-ray or an MRI. Will this tell the whole story about your pain? Perhaps your X-ray might look something like this, and the report might contain some scary-sounding words like degeneration, cartilage loss, or even severe arthritis. It might be easy to assume that your knee is wearing out and that the pain you feel is directly linked to these changes. But here's the crucial, often surprising truth. What your scan shows is not directly linked to your pain. And here's the proof. 43% of people over 50 show signs of osteoarthritis on scan but feel absolutely no pain. Imaging shows structure, not sensation. Your scan can show us the anatomy, but it cannot show us how you feel or how well you'll move. So instead of getting fixated on what the scan says, focus on what you feel, how you function, and most importantly, what you can do to improve.
And this leads us to a vital point. Knee arthritis isn't just about what's happening at your knees. It's influenced by your whole body and your whole life. Things like physical activity levels or lack thereof, overall muscle strength, not just in your legs, your sleep quality, whether you've got a lot of stress in your life, your body weight, especially if you're carrying too much weight, and past knee injuries. And that's why at Be Mobile, we treat knee arthritis as a whole person condition. And that's how you should treat it too. So knowing all of this, what actually is the best way to treat knee arthritis? What actually works for long-lasting relief and mobility gains, especially if you're over 55? Okay, let's break down the treatment options and have a look at what the evidence truly says. And before we do, I want to be very clear. Not all treatments are equal. Everything has a cost and a benefit, so let's be smart about what we choose. The Royal Australian College of General Practitioners has put out a comprehensive set of guidelines for the management of knee arthritis based on the best available evidence. Let's start with common treatments that are ineffective and not recommended by the guidelines. Knee arthroscopy, also known as keyhole surgery, supplements like glucosamine, fish oil, or turmeric, and treatments such as shockwave, ultrasound therapy, or expensive custom orthotics. So if none of those treatments work, what is recommended?
There are 3 strong recommendations. Number 1, weight loss. For those carrying extra body fat, losing even a small amount can make a big difference. 2, education. Like this video, understanding OA helps you to take control. And 3, exercise, the absolute cornerstone of treatment. More on that in a second. And yes, you absolutely can start with exercise, even if you've been avoiding it due to knee pain. Now you might be thinking, exercise, won't that wear out my knee even more? The doctor said I have bone on bone. We hear this all the time, and we do get it, but here is a powerful truth that might just change your perspective. Knee arthritis is not a wear and tear condition, it is a wear and repair condition. Appropriately dosed exercise can help your knee to get stronger, more resilient, and less painful. It sends messages to your brain that movement is safe. Just listen to one of our online members, Valerie. My knees were really painful a couple of years ago. I was scared to exercise before I found Be Mobile. Now here I am with good, strong knees and no pain anymore.
Okay, here's what you've been waiting for, our go-to exercises for knee arthritis. You don't need a gym or any fancy equipment. We're going to show you some easy starting points, some modifications so that you can make it tolerable for yourself, and then some progressions so you can get stronger over time. Let's dive in. The first exercise is a sit to stand, which is a brilliant exercise for building quadriceps strength, but also so handy for daily activities like getting up out of a chair, up off a toilet, or getting out of the car. Now, to start, what you're going to do is find a stance width which is comfortable for you. That could be narrow or wide. And here's a key physio tip. I want you to rock your nose forward so it's over your toes. Nose over toes before you stand. That's great for your balance. Now, if doing a regular sit to stand from a chair is too tough for you, here's how to make it easier. You can put your hands on your legs as you stand, or potentially use armrests, okay? But you can also increase the height of the chair. Using a couple of cushions stacked up is a great way to do that, and you'll find that is just that little bit easier. And as time goes on, you can take away those cushions to increase the difficulty. Speaking of increasing the difficulty, one of the easiest ways to do this is to use a lower chair. But if you don't have that, increasing the resistance by holding a backpack for some weight filled with books is a great way to start. Or you could even hold maybe a dumbbell or any other weight equipment you have around the house. And that's how to make it even more difficult.
Next, we're going to do a glute bridge. As the name suggests, this is working our glutes. It's also going to work your hamstrings a little bit too. So I'm down on the floor for this one, but if that's difficult for you, you can do it on a bed or a couch instead. So in this position, knees bent, and we're simply driving our hips up towards the ceiling. Now, with your knee arthritis, that might be a little bit uncomfortable, so it can help to straighten the legs out a little bit more. And by doing that, you might find you can do that glute bridge a little bit more comfortably. So just play around with that foot position and see what works. Now, if that plain glute bridge is a little bit too easy, we can add some weight. So a dumbbell like this or a backpack, and you're simply going to hold that on your stomach or sort of on your hips there. And then you can go through your glute bridges like that. That's going to be a little bit more challenge. Now, the last version to try, if you're really progressing, is a single leg version, which is obviously a lot harder. So one leg is going to lift up into the air like that. And then now we're just doing all the work through, in this case, my left leg. It's really good for building the glutes, the hamstrings, and can be a great strengthening exercise, which you can incorporate as part of your knee arthritis program.
Exercise number 3 is the heel raise, and we're going to be working the muscles here of our lower leg, our calf muscles, okay? Which are going to be really important for things like walking power. So find a sturdy bench or a chair like I've got here, and we're simply coming up onto our toes, raising our heels as the name suggests. Now, to make it easier, you're just going to put more weight into your hands, but we want to avoid rocking forward like this. Once again, straight up onto your toes. Okay, now to make that double leg version a bit harder, you can either put less weight into your hands or chuck a backpack on filled with books or hold a weight in your hands. And the same thing applies going straight up onto our toes. And to make that even harder, we're going to go to a single leg version. So we're taking all of our body weight on a single leg, which is significantly harder.
Our next exercise is the step ups. Of course, you're going to need a step for this one. People with knee arthritis often struggle with stairs, and so this is going to build strength and make those a little bit easier. So nice and simple, we're just stepping up and down. It's nothing more complicated than that. When starting out, I recommend leaving the leg that you're working up on the step the whole time, and you can just go through repetitions like that. To make it easier when starting out, use that handrail or 2 handrails if you have them, because that's going to provide a little bit of support. Now, over time, as we get stronger, we want to make this harder. There's a couple of ways you can do that. You can use a taller step if you have access to one, because that's going to make it more challenging, or you can just add a little bit of weight. So you could use a backpack like this, or you can hold weights in your hands. Either way, that's going to make that step up a little bit more challenging. This one's really good for building quad strength and glute strength and is an essential part of a knee arthritis program.
Okay, the fifth and final exercise is going to be skater steps. Now, often when people have knee arthritis, they complain of feeling unstable, especially when they're moving laterally like that. So this exercise, skater steps, is going to be working on the quadricep and glute strength for our stability and balance. The easiest variation is going to be holding onto a bench or a sturdy chair or something like that, and we're going to be stepping from side to side and then holding that leg in the air, just like that. From the side, you can see that I'm a little bent over, so that I'm really engaging my quads and my glutes. Okay, as you feel more confident, you can do it without holding on. Once again, stepping and lifting that leg. Now, to make this harder, you're going to take a bigger step, and you also can hold it for 2 to 3 seconds extra to really challenge your leg muscles doing this exercise. And then you're just going to keep practicing this and watch your balance and stability improve. Okay, so for all of these exercises, we recommend doing 3 lots of between 10 and 15 repetitions at least twice weekly. And remember, to feel some discomfort is okay. As long as it is tolerable, you can continue. Remember to start at a manageable level and then build up gradually over time. Consistency is the key, not intensity. Now, we frequently get asked, will exercise stop me from having to have a knee replacement?
Well, for some people, at some point, a knee replacement is the right option. It can be life-changing, but it should never be your first step.
And we recommend thoroughly trying those strategies that we've talked about. Number 1, weight loss if you are overweight, educating yourself, and of course, trying those exercise strategies like the exercises we just showed you.
If you've given those a dedicated effort, ideally for 6 months or more, and you're still severely limited by pain or mobility restriction in the joint, then speak to a doctor or physio about your options.
But crucially, Brody, even if you are going to get a knee replacement, you're going to be so thankful that you used those strategies and got fitter and stronger before going into surgery.
Because it absolutely improves your recovery and will help you get back to doing the things you love sooner.
Okay, let's quickly recap the most important takeaways from today's video.
Number 1, your scan doesn't define your pain. Knee osteoarthritis is based on symptoms and function.
Your knee joint does not wear and tear. You can think of it as wear and repair.
Pain during movement doesn't mean damage, it means sensitivity.
The right exercise done at the right level makes your knees stronger and more resilient.
We truly hope this video gave you some confidence in managing your knee arthritis. And if you're ready to take action, we'll start with these simple, effective exercises today.
And if this video gave you clarity or even just a glimmer of hope about your knee osteoarthritis, well then make sure you hit that subscribe button. Thanks for watching.